Hi guys, it's Patrick from Fix You Physio in Sligo and Letterkenny. So carrying on to this week's information videos about everything to do with knee problems or knee complaints. And today we're going to talk about the ACL or the anterior cruciate ligament. So if you've seen Monday's video, it was all about basic knee anatomy. So if you've seen it, comment, let us know what you think, if anything else you think should have been included. If you haven't seen it, go on our YouTube channel and you'll be able to see that video right now. Yesterday's video was all about the meniscus. What is the meniscus, where it is, its function, why it causes you pain, and what you can do to rehab it. So if you've seen that video, let us know what you think, or if you'd like anything else to be included, let us know. If you haven't seen it, go on our YouTube channel and you can watch that right now as well. And today we're going to talk about the ACL. So the anterior cruciate ligament is a really common injury or ligament to get injured in amateur and professional sport. So there's two main ligaments in the middle of your knee, your anterior cruciate ligament and your posterior cruciate ligament. So your anterior cruciate ligament stops this bone here, which is your femur on top, and your tibia underneath, and then your kneecap is here. So your anterior cruciate ligament is going through from a little point right inside your knee, just in here, diagonally through to the middle of the back inside part of your kneecap. Of your knee. So it goes through diagonally like that, and if you imagine the start and the finish is here crossing the joint, if I tried to pull this shin bone forwards, then that ligament there would stop it from moving forwards. So if I put a movement like that, where you can see the bottom going to there, the end point that I'm coming to is the end or the stretch on your ACL. So if I take this kneecap out of the way, then you can see your ACL is right in here. So it starts from the front here and goes through and back up onto here, and there's different kind of branches or parts of it, and attaches right up diagonally up in here, just around the corner. So if you were to stretch that ligament there, then it would prevent this shin bone from moving forwards as this starts to tighten up. So common injuries for your ACL. The most common thing people can think in soccer players is they've planted their foot in the ground and they go to turn, and then they get so say your left leg is planted and you're turning to the right and you're going to turn, and someone comes in to tackle and hits their knee and causes their knee to bend in the way. And that's a rotation and bend in the way which puts this under the most amount of force and it ruptures. We'll talk about mechanism of injury in a little bit, but that's the classic pattern where your knee is a little bit flexed or a little bit bent, you're pivoting on the spot, you go to turn, and then you have a valgus force, so your knee goes in the way. You hear a pop, you fall to the ground, and generally it's not that bad afterwards. The next few hours your knee blows up and you've got a lot of fluid, a lot of swelling in there, and a lot of the times pain isn't the biggest factor at the start. You've got some discomfort with it, but it's more the immobility or the fluid in the joint is the factor. And that fluid stays there for the first little bit. So with ACL injuries, there was a study done this year by Omni et al. and Johnston et al. In 2015, and they found that over 70% of ACL injuries were actually non-contact, so not caused by another player, but kind of like Farrell at the weekend, getting his foot caught in the turf, twisting an injury to his ligaments, could quite likely be his ACL. So with ACL injuries, people are at risk of getting ACL injuries, and there's different things you can do to reduce your risk. And at the minute there's an awful lot of research being pumped onto ACLs in terms of rehabbing them, in terms of what the best surgery, the new types of surgery. Some of the guys up in Santry are really pushing forward some ACL surgery with that. But also, what can you do to prevent it? There's nothing as good as whatever you start off with in your body. So the ACL that you have originally is always better than any graft that you can get put in there. So it's much better trying to be proactive and trying to get your risk lowered by doing a prehab and maintenance program, highlighting weaknesses and getting those sorted out, and trying to carry through that reduced risk into whatever sport you do. So Omni et al. 2018, they done a study whereby doing progressive hip strengthening exercises for 3 times per week and reduce your injury risk for ACL by 60%. So just by doing some simple exercises 3 times a week, which isn't much for those contact sports or those pivoting sports, you can reduce your ACL injury by 60, the risk of ACL injury by 60%, which is quite big. And there's different rehab strategies and maintenance strategies for adults. There's some published peer-reviewed evidence-based strategies for adults, and there's also ones for kids as well. So in Australia and Melbourne, or well, in Victoria in general, there was a 147 increase of ACL injuries in kids aged between 10 to 14 years in 2005 to 2015. That was a study published in 2017 highlighting the increase of ACL injuries in kids, especially that age 10 to 14 years old. It's a problem area because full-grown adults, we're not going to grow anymore, so you can get your ACL done as quickly as you can get into the surgery. Whereas kids, you have this waiting game of trying to let them grow long enough and trying to get to a stage where they're almost fully developed before you think about it. So it's a lot of issues with it. So with ACL injuries, because what happens with your knee is you tend to rotate, pivot, pop, and your knee almost dislocates a little bit and then snaps back in. So a lot of people thinking that the pop they hear when they tear their ACL is the ligament itself. It's actually usually not. I've been chatting to a few surgeons who've said this, that it's the knee actually relocating or popping back in with such force that you end up hitting this side of the bone off this side of the bone, or vice versa on the other side. And what that does with the meniscus that we talked about yesterday, you get an awful lot of force being put down through the meniscus, and a lot of times you get associated meniscus tear in the posterior horn, and you can also get bone bruising from the bones just hitting each other. So with the fluid, usually a bit of blood in the joint, one of the best things you can do to start with is getting on a static bike for 5 to 10 minutes with no resistance, just to get your knee moving and try to push the fluid out. And generally any of the ACLs that I've seen very acutely, even that day or 2 days afterwards, if you can get them on the bike comfortably, the range comes back quite quickly and they get much more comfortable quite quickly. And then going forwards in terms of getting your ACL repaired, surgery, those that do physio to get full range and some strength work done do much better post-surgery as well. It's a lot easier to get them through. ACL surgery is usually not the worst painful surgery you can get. You've got limitations at the start, but you've got a kind of a 9-month pattern of progressive exercises and ability, and you've got speed, agility, and all your strength work at the end as well to return to sport. But you have a big picture of rehab that you have to go through to get your ACL. So ACL surgery requires a huge commitment and responsibility on the patient to commit to that rehab pattern afterwards. And then there's different statistics for people returning to sport, fear avoidance stuff, and different things to come across. But it's a really interesting one to get. So if anyone has had ACL injuries and they've had surgery or they've chosen not to have surgery, if you think you've got an ACL injury or if you've got any knee pain, send us a message on our Fix You Physio Facebook page or call us on the Fix You Physio Facebook page number, or alternatively watch our YouTube channel. So we're going to have more information about exercises next week on these. So I hope you found this useful.